Hi everyone, this is Dr. Stefan. Welcome to another video. In this one, I'm talking about froggy throat from inhalers. Well, I don't know. This is what the comment says, but I thought it was a funny way of putting it. So I'll read you the comment and then we'll talk about it. So, is there any way to reduce the froggy throat? I do rinse my mouth after taking my inhaler, but also can the powder cause wind, which I never used to have before? So I think this is an interesting comment. Froggy throat, I guess it refers to that sensation that there's a bit of a voice change or a bit of a rattle after taking the inhaler, after using an inhaler for a while. And that can actually happen. It's a known side effect of many inhalers, especially the corticosteroid inhalers. They can cause that. So actually many of the inhalers that are used for asthma, for instance. Some of the ones that are used for COPD as well, but mainly for the ones that are used for asthma. This brings up the point, as the person who's put the comment to the channel rightfully said, that it's really important after you use an inhaler to try and rinse your mouth. But I would also suggest that you do this in a more involved way. So as you take a sip of water, you actually gargle a little bit so that the water sort of rinses your throat, and then you spit that out. So I wouldn't swallow that if possible, because the point is that you've inhaled, if you've used the inhaler correctly, the powder or the puff, the little suspension of particles has made it deep within the lungs. It's settled there where it needs to treat the airways. So it's a topical sort of treatment, but then it doesn't need to work anywhere else in the body. So you don't need to swallow that powder. You don't want it to be resting around your vocal cords because it can cause some problems there. So I think really, really important to take this point if possible. After you use your inhaler, it's best if you use it correctly, first of all, because that can also lead to some problems. But say you've used it correctly, you have a very good technique, you managed to inhale everything correctly deep within the lungs. After you've used it, it's wise. I know it can be a little bit unpleasant and you may not be able to do it all the time because you may be in public, you may be at school, you may be in somewhere else. But it's really good. It's a good idea to take a bit of water, go to the bathroom somewhere else, I don't know, where you're a little bit more private. Gargle, gargle, spit. But I know it's unpleasant, but honestly, just spitting out all that powder that could be left around your throat can prevent some of these complications of getting this voice change, this hoarseness in your voice, this rattle that can come up with using that particular inhaler. Now, there's a few things you can do if this still goes on. So say you've been using your inhaler absolutely correctly, you have a good inhalation technique, you're rinsing your mouth, this is still causing some problems. The next thing would be whether you may need to use a spacer. So this is for puffers, so the inhalers that actually release a plume of particles that you need to inhale. For these ones, you can generally use them with a spacer. Now, the point of the spacer is actually it helps you inhale deeper within the lungs in some instances if you use it, but also one of the main things is that when you press on the puffer, on the inhaler, when it releases that plume of particles, generally the particles around the edge of that plume are a little bit larger. They tend to deposit closer. It's physics, really. So the heavier a particle is, the closer from the point of origin it will deposit. So if you're thinking about your airway as a long tube, right? So if you're spraying and inhaling that spray, the heavier particles will deposit in the throat, mouth, trachea, rather than deep within the lungs. So the spacer actually gives you that extra little bit of space between the inhaler and your mouth to allow those large particles to deposit inside the spacer rather than in your throat. So it can be a way to reduce that potential side effect. The other thing you can do, not every inhaler is good for everyone. So for instance, if you've been on an inhaler that's really causing you that problem, that hoarseness in your voice, you're doing everything right, you're using maybe a spacer, or if it's a dry powder inhaler, you're just using it right, you're rinsing your mouth, you may need to change to another inhaler. So this is where I think it's important to keep a good relationship with your doctor, with your asthma nurse, or whoever is the healthcare provider who's been prescribing the inhalers for you, because it's just important to make sure that you're on the right inhalers for you. I think given the amount of inhalers, the number of inhalers that we have these days, there are so many options available. So I think you probably find one that works better for you. And another thing that we do sometimes is that we rotate inhalers. So you may start on an inhaler, you develop a little bit of an issue with it, we switch you to a different one for a while, then we can switch back, then we can change to a different one. There's different types of combinations that we can do. So I think it's just a matter of working with your healthcare providers, and I do encourage you to always seek their advice. It's good to see a person, to talk to them and work through things. They can check your inhaler technique as well. So if you go to your healthcare provider and you show them how you actually use the inhaler, they might actually have some tips for you on how to use it better. So these are things that I think help a lot. Now, whether the powder that you inhale, whether the inhaler that is causing wind, this was the second part of this question that I received. This can happen. So actually, it does. There is a connection between using certain inhalers, the bronchodilators, and swallowing them, because they can actually relax the sphincter at the top of your stomach. So this is, again, something that can happen. So for instance, if you've been swallowing that solution, powder, whatever, it can actually cause a little bit of weakness in this muscle that's closing up the stomach. So you might get a bit of burping, a little bit of acid reflux, which can also worsen the asthma, paradoxically, because that acid can irritate the airways as well. So it's kind of important to kind of think about these things. There's many aspects to using inhalers. It is easy. They're very, very good, very efficient treatments. Honestly, if we didn't have inhalers, I think a lot of people would struggle so much with respiratory diseases. I think they've actually done wonders for patients who have chronic respiratory disease. But at the same time, we need to be mindful of these issues. So yes, potentially you can have increased acid reflux if you are potentially not using the inhaler correctly. You're swallowing some of the solution, the plume of particles, the dust, the powder that's being released. If that kind of is swallowed, it might cause a little bit of discomfort in the stomach, a little bit of weakness in the muscle that closes up the top part of the stomach. So yeah. I think it's important to kind of go from the inhaler technique first. Make sure that you're using it correctly. If you are still having an issue, try to rinse more. Be a little bit more aggressive with it. Let's say, if that, for lack of a better term, just gargle, spit some water. It's unpleasant, but it might be worth doing. If that doesn't work, consider using a spacer. If that doesn't work, consider working with your healthcare provider to see whether you could be swapped to another inhaler, and see if that works better. You may need to try a couple until you find one that's right for you. And yeah, it can cause a little bit of acid reflux. So being mindful of what you eat, not going to bed with a full stomach, things like that might be helpful to think about as an overall picture. Hopefully this was helpful. If you have further questions, do leave them in the comment section. I'll try and answer them. All the best and good health.